Okay, after having a successful pregnancy, when we have done everything, we have managed pain, this patient have kept rehydrated, we have given folic acid, minor sickle cell crises, we shall start to plan for delivery. And we should sit down with the mother and plan. One, timing of delivery. A planned delivery that is around 38 to 40 weeks may be ideal if there is no complication. However, earlier delivery may be necessary in the presence of maternal or fetal complication. This means we can leave this mother to go up to term and have a normal vaginal delivery. But if there is any complications, maybe the mother is getting more episodes of the crisis, maybe the fetus is deteriorating, then we can induce or take this mother for a cesarean section. But then we also talk of the mode of delivery. We shall preferably need a vaginal delivery unless when there is any obstetrical condition. But if the pelvis is okay, the baby is okay, then this mother preferably would use a vaginal delivery. However, continuous fetal monitoring during labor is recommended due to the increased risk of fetal distress. So depending on the mode of delivery will tell us what to do postpartum. But postpartum, we closely monitor the women for infections like for complications like infection, pain crises, thromboembolism. We need to follow up the patient or closely monitor this patient. Then breastfeeding. Women with sickle cell anemia are generally encouraged to breastfeed unless contraindications do what? Exist. But this mother should be encouraged to breastfeed her baby. Restrict activities during crises by encouraging good habits, relaxation, and sleep. So then after that, let's talk about sickle cell emergencies. And one of the sickle cell emergencies is what we call the sequestration crisis. And sequestration, splenic occurs in the spleen. Splenic sequestration is a problem mainly in sickle cell disease, which occurs in the spleen. Blood in the spleen is separated from rest of the blood supply. This means that as blood moved to the spleen, somewhere the cells became sickled, and when they become sickled, they block the blood to go out and even blood to enter. So blood is trapped up in the spleen, and that is called a splenic sequestration. The sickle red blood cell block the blood vessels inside the spleen, and this prevents blood from leaving the spleen. A large number of blood gets trapped up in the spleen, which causes the liver to get swollen. Once blood cannot get back into the circulation, the hemoglobin level will fall drastically. There may not be enough blood left in circulation for the vital organs like the heart and lungs to act normally, which can lead to shock and death. So here we say that blood is trapped up in the spleen, and as it's trapped up, here in the normal circulation, the blood left behind may not be enough for the vital organs to perform perfectly well. And we said this is very serious, which can even lead to abrupt death. And the signs and symptoms, of course, they will be related to anemia, that is pale color, lips, gums and nails, fast breathing, fast and weak heartbeat, and pain in the area around the spleen. Then another one is called vaso-occlusion, when the blood vessels are obstructed by the sickle red blood cells causing ischemic injuries. We also have aplastic anemia. This is caused by a bone marrow depression and involved in all blood elements, resulting into pancytopenia. Pancytopenia means insufficient number of red blood cells, white blood cells, and platelets. So the bone marrow stops making the red blood cells for the short time, and this causes a short time drop of hemoglobin, that is the red blood cell count, and the word aplastic means unable to form.